know around all those subjects. I'm really excited. I've been looking forward to this forever. Just getting to have this conversation. It's always a great team and a great time. So whether you're kind of, tuning in on Livestorm, I know some of you might be in our Winona Women's group, WWG, if you've been in there a while, long enough to learn the acronym, but we're so glad that you're here and you're joining us. And I think it's just going to be a great conversation that we have today. So in a moment, I'm going to pass it off to the doctors just to introduce themselves. But just as a reminder, we're going to go ahead and have like a little bit of conversation first. And then we're also going to have a time, of course, for you to ask all your questions that you might have. We're here to answer anything and everything that might be on your mind, that might be burning in your head. So go ahead and you can start putting those in the chat. And then we'll be able to come back to them in a little bit and like really get to answer those. But I'll go ahead and pass it off to the doctors to introduce themselves, and we'll go from there.
Great. Thanks so much for having us here. I'll introduce myself first. My name is Dr. Ajay Harani. I'm a primary care physician by background, and I'm the head of clinical quality here at Nourish, which I'll tell you a little more about in just a bit. And I'll pass it over to Zoe to say hello.
Yeah, thanks. I'm Zoe Halbert. I'm a clinical manager and registered dietitian with Nourish. I've been with Nourish 3 years, and I'm based in Austin, Texas. But yeah, I'm here to just share a little bit more about what dietitians are doing and a lot more on nutrition interventions for menopause. So super excited to be here. And I have a background in chronic health and women's health. So just really excited to share more on this topic.
So I'm Mike Green. Many of you know me. I'm the Chief Medical Officer of Winona. I'm super excited to have our friends from Nourish here. So this is going to be a little bit different than what we normally do. Usually I stall for a few minutes while you get some questions in to answer. But we're going to do a lot better than stalling. And I've asked them to talk a little bit about what they do and also just about nutrition and menopause and how it all interrelates. And so they're going to take some time doing that, which I think is going to be incredibly valuable. While they do that, please put your questions in so we have something to do for the second half. Otherwise, we could just chat and have a good time, but it'd be much better if you have questions. Really, we appreciate your questions. We'll take questions on anything, but particularly as it relates to diet and nutrition will be particularly valuable, so we can pick the brains of the experts that we have today. So with that, I'll turn it back over.
Awesome. Well, I'll kick us off and just tell you a little bit about what we do as an organization, kind of what our mission is, and a little bit about what working with us looks and feels like. Then we'll move into some of the content about specifically the nutritional aspects and kind of pillars of managing menopause. So a bit about Nourish. So Nourish is the largest food as medicine platform. We believe that poor nutrition is driving some of our biggest difficulties in healthcare today, and we're making it easier for patients to eat well by expanding access to high quality nutrition therapy. So what we do is we match patients in a one-on-one relationship to a registered dietitian who's a fit for their needs. They'll work together both in that relationship, and the patient also has access. Oh. Hello.
Hey, Dr. Kat.
How's it going?
It's going pretty good. I think the Nourish team has given a little bit of their spiel of what they're working on. Yeah, Nourish team, I think you can keep on going.
Keep going?
Yeah.
Cool. Great. Sounds good. Right. So we match patients in a one-on-one relationship with a dietitian, and that person is there specifically to help them throughout their journey in every avenue, from messaging their dietitian or access to the app where you have a library of food recipes and other tools that we'll talk about shortly. We are particularly excited to partner with organizations providing high quality, personalized clinical care, especially where as a healthcare system, we've historically missed the mark. And that's why this partnership with Winona on menopause is very important to us. And we're super, super excited to be here. I'll pass it over to Zoe to talk a little bit more in depth about, what the work that we do and what it is to work with a dietitian with us.
Thanks, Ajay. Yeah, so as you mentioned, we are pairing people with dietitians via telehealth. And I always like to start off just to explain a little bit what a dietitian really does and what they are. So of course, they're a healthcare professional that specializes in food and nutrition, but it's easy to get it kind of confused with nutritionist versus dietitian. So what I like to always kind of remind people is that all registered dietitians are nutritionists, but not all nutritionists are registered dietitians. So registered dietitians have special training so that they can administer something we call medical nutrition therapy, or MNT, which essentially is a method where we can provide interventions for specific disease conditions, in addition to also, of course, teaching about general healthy eating as well. And MNT is a personalized and evidence-based approach, so it's really individual to each patient. And it's a process that follows a really specific format where we really get a thorough assessment of a patient to really understand their lifestyle, their diet, their background, to really understand someone holistically, so that we can then identify what nutrition concerns and problems are going on, and then approach it with that patient to collaborate on goals and provide tools, resources, and strategies to then help them meet their health goals. And that's the long answer of what a dietitian and MNT are. I would say the short answer is dietitians are just a bunch of foodies who are just passionate about health and wellness, almost by coincidence. But we love food and we love to talk about it and educate on it. So that's the quicker answer. Awesome.
Awesome.
Yeah,
Thanks, Zoe.
Dive in.
Perfect. Yeah. So what I'd love to do is just start the conversation a little bit. And as Dr. Green mentioned, please, as you have questions that come up, send them in. We're excited to have a discussion with you. You know, nutrition as a topic in itself is so complicated, and there's so much information out there that we have access to, and it's hard to tell the good from the bad and what might be useful for you. So we're happy to help be kind of a first pass and just help you think through that entire landscape. So obviously here, as we're talking about specifically the intersection of nutrition with menopause, and what we're going to be focusing on is, you know, and kind of the framework for the discussion here is the different ways in which menopause can affect the body through a few different things that I'll go through in just a second here. We're going to talk about both how we're going to talk about things that can help you in your life feel better and things that can help you in your life live longer and kind of improve your lifespan, you know, in addition to improving the quality of your life. Both of those things are very important to us, and I think you'll hear both of them kind of come through here as we talk about this thing. In any kind of clinical situation or any clinical diagnosis, you know, we believe nutrition's a core pillar of managing those symptoms. As it comes to menopause, nutrition can be both an adjunct to hormone replacement therapy, if that's what you're currently receiving, but also it can be a really powerful thing for you and a powerful tool, even if you're not currently on hormone replacement therapy, to try to help you with some of the other things that are happening in your body. In either case, it's a powerful clinical intervention in the management of menopause. The 5 kind of subjects or topics that we're going to talk about today are, and this is of course not, you know, a fully comprehensive view on all of the changes that are happening in the body during menopause, but it's our kind of initial framework here that will share some of the nutritional takes on how to manage each of these conditions and each of these concerns, and then we're happy to kind of take your questions from there. So the 5 buckets for us here today are: number 1, heart health; number 2, metabolic health; number 3, bone health; number 4, weight management; and number 5, symptom management. Those are the 5 that we're going to go through today. Just to start here, as to kind of to get the conversation going and get questions going, I'm going to hand it over to Zoe in just a second to go through what some of our strategies are for thinking through each of those buckets, and then would love to take your conversations from there.
Awesome. Thanks, Ajay. So yeah, I'm going to take a little deeper dive into all of these things and all the interventions and nutrition strategies we are really focused on, especially when someone's going through menopause, with all of these different issues that we want to be thinking about. So I appreciate you kind of introducing that. The first thing I always want to mention is one of the most important things is we always want to set up a really strong foundation for our nutrition. And that's really through eating solid, balanced meals. I think that's term is thrown around a lot. And so I do want to always address that important factor that we want to start with that strong foundation. And then from there, we can really individualize things, look at more specific key nutrients. But when we're talking about balanced meals, right, that's talking adding adequate protein to meals, right? Our lean proteins are what we're looking for there, whether that's through chicken, turkey, fish, our legumes, right? This is going to really just be a foundational nutrient that we want in our diet to make sure we're preventing muscle loss, supporting joint health, and just long-term activity in the long run. We're also going to be wanting to include fiber in our meals, right? This is going to support our heart health, may help with weight loss as well, if that's something we're working on, and digestion. It's also going to include healthy fats, right? So our unsaturated fats, olive oil, avocado, or those foods that always come to mind, along with complex carbohydrates to help balance our blood sugar. And of course, hydration. I always mention that water is a really important component. So I always start with that because I think that balanced meal is just one of those foundational key components we want to make sure is a part of our lifestyle. And then we can dive into some of these kind of key nutrients and important things we need to pay attention to for each of these health concerns as well, which someone might have more, heart health be more of a risk factor than another person. So we're always kind of individualizing this too and looking at what the big focus is. But for someone where heart health is a big focus on, we're going to be looking at making sure we're eating adequate fiber, but also the right types of fiber. We know that soluble fiber, such as an oatmeal, for example, can help reduce cholesterol. So we're going to really be maximizing these foods. We may also be thinking about fats like omega-3 fatty acids. We find these in fish, but also chia seeds and flax seeds. These are going to be amazing for reducing inflammation in the body and also have additional heart health benefits. Also can even contribute to mood regulation, which is also a really important thing during this time. So this is another nutrient we're going to pay a lot more attention to. And then, of course, if we're thinking about just our overall metabolic health, we're going to also be thinking about balancing our blood sugar. So that's where those like complex carbs I mentioned really come in, and fiber, making sure we're eating right starchy vegetables instead of refined grains, more whole grains instead of those white breads and things like that. These are going to really help not only keep us with great energy throughout the day, stable energy, but really help our metabolic health overall. And we may also maximize pay attention to some of these more small vitamins and minerals. Things like B vitamins play a really big role in our metabolic health. So making sure there's no B12 deficiencies, B12 and B6 particularly play a really big role in energy metabolism and mood regulation as well. The other things we'll mention is bone health. This is a big one because with these hormonal changes, that risk of osteoporosis increases a lot. So we might pay more attention to vitamin D and calcium. Those nutrients in combination are really important for maintaining and supporting our bone health. So we're going to be looking at getting more of those foods in, things like our dairy products, but also maybe some of our soy products that are fortified with calcium. Nuts and seeds are another great source, our leafy greens. And vitamin D is a good one. This is actually a pretty common deficiency, even in places that are relatively sunny, which we know we often always think of sunshine comes along with vitamin D. But this is an important one to check in on because we do see this deficiency regardless, sometimes even in different environments. So sometimes we may even need to supplement if we can't get it through those fortified food sources or safe sun exposure. And then, of course, we're going to be looking at our weight management. This is a very common problem that a lot of people are reporting during this time in life, is struggling with more weight gain or struggling to lose weight. And there's a lot of things we can do to address this. Those balanced meals I mentioned are definitely a big part of this. One of the key things we want to be thinking about is how can we make sure we're staying satiated, having good energy, right? Not getting overly hungry so that we can manage our appetite and really keep stable intake throughout the day and still get that adequate nutrition. So those balanced meals are going to come in really handy to help us with hunger fullness. We're also going to really look at protein. It's particularly satiating. So that's definitely something we're going to make sure we're getting enough of. But also if someone is trying to lose weight, we want to protect their muscle mass as well, because we don't want to lose a lot of muscle tissue. That's really important as we age to keep as much as we can. So I also really want to emphasize that protein for that purpose as well. And then I did want to mention on the symptom management side, we get a lot of questions on this as well. And there are some really great things we can do. One, balancing our blood sugar, like we mentioned before, is actually a big part of this, because this can help with preventing sleep issues if we're having stable blood sugar, can also help with our mood regulation. But there are some nutrients that also play a role in this as well. One I like to mention is something we call phytoestrogens. So these are plant compounds that we find in foods like soy, but also like chickpeas and flax seeds have these as well. But I'm always thinking like tofu, tempeh, soy milk. These are all great sources. And these have been shown to help with some symptoms, especially things like hot flashes. And one of the reasons is because they are actually they mimic estrogen in a sense. So if we have low estrogen, they have an estrogen boosting effect essentially. So they can work really well in tandem with other therapies and things that people are doing to help with symptom management. So that can be a great food to be incorporating. Also, antioxidants I always bring up. So these are found in a lot of our fruits and vegetables, but also things like green tea, even dark chocolate has some great antioxidants. I always have to bring it up because that's my favorite food. But we want to always be eating the rainbow. I know it's a cliche thing to say, but it's really applies to antioxidants. When we're getting a variety of colorful fruits and vegetables, we're getting tons of different antioxidants that are going to help reduce inflammation in the body, fight off chronic disease, and even support things like skin health and joint health as well. And let's see, did we cover a big one? Let me make sure I got the big ones here. Yeah, these are the major ones I like to talk about. The one other thing I wanted to highlight, though, is we talk a lot about what to eat, and that is super important. But what's also important to dietitians is how we eat as well. And I never want to forget to leave that out, that our eating practices, how we're timing our meals so that we're actually feeling satiated, are we eating mindfully? These are all things that also play a huge role in how much we eat and the satisfaction of our food, and that all leads up to our health as well. So these are also important things that we want to be implementing. And I always say the magic with dietitians, we can talk about phytoestrogens all day, but I always say the magic is really bridging the gap between education and action. And so that's my favorite part of the work we do, is we can really translate all these nutrients into everyday recipes and everyday meals. Because most of us aren't writing phytoestrogen on our grocery list, we're writing tofu or an actual food product. So I always like to give that example. If we're planning a breakfast, I might be saying like, okay, we're going to eat some oatmeal today, but and that's going to have that amazing soluble fiber, but let's add some antioxidants. Okay, we're putting berries on that meal now, right? Oh, let's add in some nuts and seeds. We're going to get some healthy fats and protein in there. Maybe we're putting some soy milk to add a little bit of phytoestrogens in there, and a little bit of honey just to make it taste better, because why not? That's always enjoyable meals are important. So these are just kind of how we might take, all these different nutrients and actually put them into an everyday meal. And yeah, I think at that, I want to make sure we have plenty of time for questions, but I just wanted to give that little overview of nutrition. We'll get into all the nitty gritty, but Ajay, if you want to take it over to talk a little bit more about our approach and personalization.
Yeah, I think the last thing just to mention there is that, as kind of Zoe went through, there are, of course, a ton of different guidelines to follow for nutrition. But that much of our focus here at Nourish is that, if you sign up and you're working one-on-one with a registered dietitian, it's about how do we make these changes in your life today in a way that feels sustainable for you. And so then we're thinking about, who else is in your household, right? Who are you sharing meals with? We're thinking about where you're getting your food from on a day-to-day basis. And we're thinking about, what has your relationship to food been in prior times in your life versus now. It's this thing that Zoe mentioned of kind of bridging education to action, and then also personalizing it to you, so that you not only have a plan that feels achievable for you, that feels effective for you, but you also have somebody on your team kind of coaching you and kind of rooting for you along the way to help make some of these changes. And I think it's worth acknowledging that with all of these behaviors that we've held our whole lives, it is difficult to start making some changes, even when there's a really strong motivation to do so. A lot of our habits are hardwired, and it's a complicated process, but it's one that we take really seriously, and we're excited to help you out with. So maybe we'll pause there. And I don't know, Dr. Green or Dr. Brown, if there's any other thoughts you wanted to add there, we can open it up for questions.
I think we should go straight. Let's go to the audience.
Straight to the questions. All right. Well, I love this part, getting to like see everyone's questions. And thank you so much also, Nourish team. That was so insightful and helpful, just to like hear a little bit kind of about that and like getting into like the nitty gritty a little bit. And I love what you were saying too about like bridging the gap between, you know, like education and action. I feel like that's such like an important aspect. And I love that. I love how you said that. But so one of our first questions that we have is from Stacy Smith. And she says, I'm a few weeks into menopause. It was medically induced. And she's wondering if there are any foods she should seek out or avoid to help with mood.
Yes, I'm happy to kick off this one. This is a great question. And there are a lot of foods, thankfully, that actually do have some benefits on our mental health and mood. I say they may not replace every other intervention, but they can be super supportive. I know I mentioned omega-3 fatty acids. That's one I like to talk about a lot. But the foods we're going to find those in is going to be our fatty fish. So things like salmon and mackerel, some tuna would be a great option, but also things like chia seeds, flax seeds, walnuts are another great source. So those are ones I like to kind of talk about a lot. I will say, like, sometimes that omega-3s can be a tough one to get through diet for some people, especially for someone who's maybe not into fish that much. I find it's a little harder. So supplementation can be an option for some people as well. And sometimes that's a better option. But definitely that's one I would highlight. I generally would say one thing I would avoid more of is more like refined carbs, not from the standpoint that them in themselves are going to cause a lot of mental health harm, but blood sugar crashes throughout the day is something that can impact our mood greatly. So sticking with more complex carbs combined with protein in particular can be really helpful for keeping our energy stable and then therefore our mood stable as well. So those are really big ones that often come to mind for me.
Yeah, the only thing I'll add to that is, you know, even within Nourish, when we're talking about nutrition counseling, one of the things that this dovetails really closely with is also physical activity and kind of what our relationship is to the world there. So that's one of the things that I think about quite often when it comes to mood. Notwithstanding, obviously, all, you know, mood concerns are worth bringing to your clinician to talk about all of the different routes that might be useful for you. But in our world, where, you know, we're also thinking about getting outside, you know, regular kind of daily exercises, even if it's 15 to 20 minutes of going on a walk, really building that in as a consistent routine has been kind of a healthy prophylactic measure for a lot of our patients.
Absolutely. I love that. I think those are really helpful answers on that front. We have a question from Sarah, and Sarah's wondering, she says, suggestions on how to reduce gas and bloating. And I think that she's wanting to have that tied in a little bit with nutrition as well and what that kind of looks like.
Yeah, great one. I always say gas and bloating. I always think it's important. I always just preface, work with your healthcare providers because there's so many causes of gas and bloating. But some simple things that I do tend to like look at and just think about. Sometimes it's simple as paying attention to like what type of fibers we're eating. So even looking at, is there a difference between raw vegetables and cooked vegetables? Sometimes we do kind of experiment with that with patients. Sometimes cooked vegetables just cause a little bit less bloating. If you've recently increased your fiber intake, I always, look at, has there been a drastic change? Because that can also lead to more gas and bloating. So sometimes more gradual increases in fiber versus a big change can be really helpful, just to kind of build up some tolerance to that. Of course, there can be things like intolerances or other things going on as well. And that's something I know at Nourish we do a lot, is really look at food logs and do a lot of documentation with our patients. We look over their food logs and see if we can help identify triggers as well. There's the obvious culprits for some people, like lactose intolerance can cause this, right? There's some that are sometimes really easy to spot, but some can be a little trickier. And so sometimes also just tracking can really be helpful just for that little bit of self-monitoring to see if we can identify some big triggers there too. This one's always a big one because there's so many foods that can possibly cause this, but those are always my first kind of interventions and thoughts that I'm often looking into.
Yeah.
Let me jump in with basically a follow-up and a question for you. Often when people first start HRT, The estrogen in particular can slow the gastric and the GI emptying and initially cause a lot of bloating. So it's a pretty common side effect we see at the beginning of HRT. It usually goes away after a month or so, but nobody wants to have to get through that month. So for that specific thing, are there some dietary changes that can help as their body is accommodating to the new hormone levels and getting used to it?
Yeah, definitely. I would say in this case, usually when especially more medication induced, we sometimes look at spreading out meals. So doing smaller, more frequent meals. So we're not eating so much at one time, and that can be a little bit easier on our body to digest as well. Also staying really hydrated is really important. Just make sure we're well adequately hydrated, but you may even consider if there's a lot of bloating, you might drink in between meals a little more than with meals, just again, to make sure you're not getting so much at one time. So that would probably be the recommendation I'd give in that case.
Great.
We have a question next from Julie, and Julie says, as with the extremely dry skin I've experienced with menopause, I find that the intestinal tract is also the same, dry on the inside and out. I think this constipation is a big problem due to lack of water, not fiber. Will the HRT help this, and what can be added to my diet to address this?
Well, the first thing is water, more and more water, right? Drinking so much. I mean, basically when we get constipated, think about your body. Like the last place your body can resorb water before waste exits your body is in your large intestine before the stool exits your body. So if you are dehydrated, your body will absorb every bit of water from your stool, and then you have these hard stools that can't come out. And so if you're constipated, the first thing to do is to drink more. I mean, that's my number one answer to patients. But then I'll let the nutritionist take over if they want to talk about foods and stuff.
Yeah, I mean, I would say that would actually be my top recommendation as well. So I would never forget hydration. That is so important for our skin health. There can be other things that just can be helpful, making sure we're getting adequate vitamin C. That plays a big role in skin health. Vitamin E as well. So these are just some vitamins to focus on. So things like, of course, with vitamin C, we're thinking our citrus fruits, strawberries, bell peppers, broccoli. These are all really high vitamin C foods. Vitamin E, I'm looking more at a lot of nuts and seeds are great options. So making sure we're getting a lot of those whole foods in our diet can definitely promote skin health. But I think it's always important to come back to that. Without water, we probably won't see that helpful result because hydration is going to come first. The only other thing I mentioned is if we are reducing inflammation in our body, like through antioxidants, like mentioned, or those omega-3 fatty acids and healthy fats, that can help with skin health as well. So that's definitely another kind of thing I'm thinking about as well.
And estrogen can help with skin health as well. It can help plump up the skin, make the skin younger and healthier. So, you asked about HRT, and definitely that is one of the benefits that people often see when they start HRT. I'm going to be a bad example because I'm a Diet Coke.
Come on, Dr. Green. It looks like our next question's from Megan. And she says, it seems like food cravings and appetite seems to completely fluctuate throughout the month in perimenopause, particularly if you still have your period. Is this something you all see? Is this normal?
Yes, absolutely. Yeah, I would say this is very, very normal to be experiencing and definitely difficult. I kind of want to actually see if there's maybe from the doctors first to more the mechanism part of this, but I definitely want to address what we can do about it. But I want to address her direct question first.
So one of the big issues really with the menopause transition is the sort of spiky nature to the hormones, so to speak. The ovaries don't sort of just go down gradually. They're really working to try to get your hormones out there, but they're sort of old and, don't have the ability. And so they kind of spit hormones out when they can. And so you get these really big up and down, which is what causes a lot of the symptoms of the menopause transition. Hot flashes basically are caused by this. That's exaggerated even more when you're still going through menstrual cycles because you have the natural fluctuations in hormone levels as well. So the two things together can really escalate this. And so that's one of the ways that hormone replacement therapy helps. So it kind of increases this sort of baseline level of hormones so that when your body throws out a little bit more, it doesn't really change as drastically. And so, at least from the HRT point of view, this is definitely a real phenomenon. It's really one of the basic reasons that HRT works so well at helping with the symptoms.
Absolutely. And I think just to add on to that, sleep and stress are big factors in all of this. And having inadequate sleep can definitely increase appetite. Stress can also trigger appetite as well. So these are just good things to also look into management around as well and get support on, because if we're working on our sleep, working on stress levels, that can also help stabilize appetite, along with, again, like regulating our blood sugar throughout the day to make sure we're not having these energy crashes. I always say if we're having big, getting a lot of refined carbs in, all of a sudden having a sugar crash, that can also stimulate our appetite again to get our blood sugar back up. So the more we can kind of also stabilize that blood sugar will help with that too.
And it looks like our next question is a little bit connected to this one as well, though maybe on kind of the other end a little bit. But Danielle is wondering, she says, I've not had my period in over 100 days, but I still have carb cravings and feel more emotional around the same time I was supposed to have my period. Is this normal?
Yes, very much so. Even though you're not having a cycle, you're still having those fluctuations in your hormones. And so you're still going to have similar symptoms to when you had your period. So, that is very normal to go through that for sure.
Awesome. And then our next question is from Amy, and she says, what are your thoughts on intermittent fasting versus keto in perimenopause?
Yeah, I can.
That's a loaded question.
There's a lot here. I always look at this as, everyone is very individual, and we're always gonna, I say dietitians, we always start with what's working for someone and go from there. Just from like an evidence-based standpoint, we don't necessarily see that these eating patterns are necessary for menopause. They may have certain benefits and downsides is kind of the way we look at it. With intermittent fasting, right, and that time constraint, that may work really well. I know some people, that's just kind of their lifestyle. I would say it's not sustainable for every person, especially if it's causing overeating later in the day because we're not getting enough nutrition earlier on. This is a common trend we see. And so for that person, we might want to spread out our meals, make sure we're getting that consistent blood sugar to prevent those crashes. With the keto diet, there again, we see some research that shows, some improved with insulin sensitivity and things like that, but we don't see as much long-term sustainability on that diet. And especially when we're kind of cutting out those carbs, sometimes we see people get more carb cravings in the end, or just have trouble really keeping up that lifestyle, or they're not getting enough nutrient density, I think is one of my bigger concerns. Maybe there's nutrient deficiencies that come from that, not enough fiber intake, things like that. So, I say people can play around with their meal timing. There's sometimes, finding what fits your lifestyle is important. But I think it's good to know that neither of those are necessary to still get benefits when you're going through perimenopause. You can eat consistently and just focus on more eating whole foods, balanced foods, getting the right nutrients, and still have similar effects as you could on maybe some of these diets in a more sustainable way. But I know there's so much out there on all of these. It's a lot to dive into. And they each do have their kind of benefits and downsides. But I'd love if anyone else has some thoughts they want to share on this. Please jump in.
Go ahead, Dr. Brown.
Oh, go ahead. You can go ahead.
No, I was just going to say, I think, this is the type of situation where we'd really want to we would want to drill down to what the goal is specific to you, which is, these diets typically come up in a conversation around weight management, I would say, or improving metabolic health, something in this realm. And in that realm, we have different methods to, ultimately it's about energy balance there. And we've got to, be reducing the number of calories that we're taking in compared to what we're burning. And there's different kind of flavors of reducing that energy. And time restriction is one way to reduce the energy. We can reduce by doing keto. We're reducing one of the main nutrients here to kind of reduce the total energy that you're bringing in. But there's all sorts of routes there. But I think we just want to be careful there that, we want to be specific about exactly what the goal is we're working on together. Because if it's not necessarily weight management and it's about feeling better on a day-to-day basis, those two are going to be unlikely to be things that are going to just naturally make you feel kind of much better or much, regulated as in the way that Zoe was describing.
Yeah, I was just going to say, I'm not a big fan of things that are so restrictive, especially, and also you have to reframe eating. Like, you want to make changes that are sustainable, that are going to be lifestyle choices that you want to continue throughout your lifespan. You know, things that are going to make you healthier, live a better life. And so doing like a restrictive diet, like keto or intermittent fasting, is that something you're going to sustain the rest of your life? Does it make your body feel good? You know, and if it doesn't, like, how easy is it going to be to continue doing that? You know, I think that those might be good things for some people in the short term, but I've never met anyone that's been able to stay on either one of those plans long term and do it well and stay happy in the process.
And I was going to say also, there's a big personality thing here, I think, in individualization. I know, like, my wife and I do best with, like, if I don't have to worry about social issues with eating or time pressures, I do best with a little snack, big meal around 2, and then maybe a little snack after that. My wife would not survive that way. She needs to eat small amounts throughout the day. We're just different, and it's been that way. We've been married 37 years. It's been that way the whole time. So I think there's also, you've got to see what works for you, and what works for your friend or your spouse or your neighbor just may not work for you. It's really very individual as well, especially with those kind of diets, I would think.
Well, thank you all, for those amazing answers. And we have another question from Laurette, and she's wondering, what should a menopausal woman be eating to affect a successful sleep cycle?
Yes, this is a great question. I say there's a lot of things going on with, I know sleep disturbances are really common to come up due to hormonal changes. So one of the first things I'll always mention is making sure we're eating enough, right? That we're eating adequately throughout the day to keep our blood sugar stable. I know I'm probably going to hone in on that a million times, but that's going to be a huge part that's actually going to help with sleep. We also don't want to eat too close to bedtime. I'll say, like, I know I've heard sometimes weird rules, or people put really specific time constraints, but generally we just don't want to eat so close to bedtime that we're still going through a big part of that digestive process that can actually keep our body temperature up and actually disrupt sleep some. I know we all have had that experience of having a gurgling stomach while trying to go to bed, and it's no fun. So I do emphasize that as well. There are additional things that can be helpful. There's even some supplements that have some research that can be supportive. There's, of course, things like potentially melatonin for some people, or ashwagandha if anxiety is an issue. Like, those are things to always discuss with your healthcare providers and see if those are additional support. But I usually more focus on just generally getting our blood sugar managed so that we're not having, again, these energy crashes or having that disrupt sleep even more so. I was going to mention too, L-theanine. That was the other supplement I was trying to mention too. But these are all ones that may potentially help with just stress and sleep together.
Yeah.
I also think you need to monitor your caffeine intake throughout the day. And the other thing I see a lot of people drinking now, especially before working out, is like energy drinks.
Right.
And those drinks like Celsius and similar, they have like 200 milligrams of caffeine. And I think that we underestimate how much those substances can affect us and affect our ability to wind down at the end of the night, especially if you're having the midday or even in the afternoon.
Yeah, there's actually really interesting research that's come out recently that actually folks metabolize caffeine at different rates. And so some people can have that 3 p.m. espresso and it doesn't disrupt their sleep at all because they metabolize it in 3 hours. Other folks are much slower metabolizers of coffee. And so, you sometimes hear this anecdotally where people are like, I can't have a glass after noon, otherwise my sleep is disturbed. And other folks have a very different experience. And that experience is true. And so if you are, if you notice that, even if it's that early afternoon cup of coffee, it's a thing to keep an eye on for everybody, because it seems like it should be out of your system. But for some folks, the caffeine molecule is actually still hanging around. The other thing I always bring up here is, this is one that we always bring up, but alcohol late at night is one of the main disruptors of sleep in folks that I talk to. And this is always tricky because it's the glass of wine with dinner. And especially if it's a later dinner, it is one of the kind of single most powerful disruptors of sleep. So if it is an issue that's getting in your way, it's definitely something to try cutting back on, or potentially moving it all a little bit earlier. I've had some patients who then, if they're going to have the glass of wine, have it at 5 instead of 7:30, and move it, along with what Zoe was saying too about moving the meal up, so you're not having a meal within a few hours of bedtime. These are some of the tweaks that we can make. Most folks would say even that 5 p.m. glass is going to be decreasing your sleep quality overall. But we're kind of trying to find the right trade-offs for everyone here and see what makes sense. And then the other couple of normal sleep hygiene things that I bring up all the time, as much as you can, maintaining a consistent sleep-wake cycle every day, not getting into bed until you're ready to go to sleep. I think kind of the common adage here is, bed is for sex and sleep, nothing else. So if you're doing work, stay in your desk before you get into bed, because it disrupts that kind of mental connection you have of being in bed as a place of rest and a place of winding down. Avoiding daytime naps when you can, and then, keeping the bedroom dark at a comfortable temperature, things like that.
So you heard it here. Day drinking is the key to sleep. It's 5 o'clock somewhere.
Oh my goodness. No, those are all very interesting for me to hear as well. So thank you all for going very into depth into that. It looks like we have a question next from Jana, and this is a question I see all the time in our communities, and I think it's just a really big focal point for a lot of women in menopause. But she says, why does menopause have me stuck and unable to lose any weight? I'm not gaining, but I just can't lose. Even the strategies that have worked well for me prior to menopause aren't working.
We've talked about this before on other webinars, but basically it's because you're in a high stress state. Because there are so many fluctuations in your body, your cortisol levels are high, your body is in a fight or flight mode, and you're going to retain every calorie. Especially if you have insomnia and night sweats that are affecting your sleep, you're not getting restorative sleep, your body cannot kind of accommodate the next day. There are so many different reasons, but mainly it's because you're in a heightened stress response because of all the hormonal changes that you're undergoing. So that's the main thing. So whatever you can do to reduce your stress levels, whether it be, incorporating more exercise, improving your nutrition, adding HRT into the mix can help as well. Really focusing on your sleep hygiene, reducing your screen time before bed too is important, in addition to the nutritional changes too. But I think that all of those things, if you can reduce your stress level and reduce your overall cortisol levels, you would do better. And then your body can start, the metabolism can kick in better, and things can start moving in the direction you want it to.
Absolutely. Thank you so much for that, Dr. Kat. It looks like we have a question from Missy. And Missy says, do you have any different dietary recommendations for women who go through menopause earlier in life versus later, or naturally versus surgery?
I don't know if my advice as a doc would be any different depending on, when you go through. I think that, the benefit that women have going through menopause naturally is that it's a gradual process. And so it gives their body some time to accommodate. And sometimes it's a wake-up call that we have to make some changes in our nutrition, to help balance those symptoms. Whereas a woman going through surgical menopause, things happen kind of overnight. And so you're faced with a lot of symptoms very quickly unless you're on hormone therapy to help combat those symptoms. But I don't know. I think if anything, with the patients I've talked to, trying to incorporate healthy lifestyle changes and better nutrition earlier in life, even before you go through any transition, is going to help you be more prepared and more armed to deal with this. And I think that we don't think about that a lot in our 20s. We think we have all the time in our world, to deal with that. But I think that, focusing on self-care and your own nutrition, mindful eating, like Zoe talked about earlier, really paying attention to what your body feels like after you eat certain foods. If you feel like crap after eating a meal, mark that off. That's not something you want to eat that often. I love pasta just as much as the next person, but I have to expect to have a huge crash afterward. If you eat a huge plate of pasta, it's like I'm ready for a nap afterward.
Yeah, surgical menopause is really a different beast than natural menopause. Mm-hmm. And there's actually some very good data that women that undergo surgical menopause, especially young, like 40 or even younger have a much higher risk of cardiovascular disease, heart attack, stroke than women that go through natural menopause. So HRT can help with that. But, if you go through surgical menopause, especially at a younger age, you really, I think, want to be careful about how you eat for heart health and stroke prevention and these kind of things. Nutrition becomes even more important because your baseline risk has gone up so much from the surgery. So HRT is very important, but you also want to think about all these other lifestyle things that also can modify your risk. It's something that I don't think gets talked about very often, but is actually very important.
Yeah. The only other thing I think about in these scenarios is, adding on the recovery from surgery as well is just another complicating factor in these scenarios, and let alone the reason for the surgery, which could be any number of things that are also affecting your ability to take care of yourself. In all situations with natural and with surgical, I as much as we can, we try to get involved as early as we can in the process, months before we think so we can start thinking about what some of the life changes will be for you. And of course that tip is not necessarily helpful for any folks who are already past the transition, but it's a big hope of us having this community as we can start having these conversations and communications more prophylactically and preventatively as we can.
Absolutely. It looks like we have a question from Tessa next. And she says, we are a lectin-free home. That being said, as of 3 years ago, I started putting on weight and it has gone directly into my tummy, back, breast, and thighs. I'm a marathon runner and I am at the gym 6 days a week. Just recently had a partial hysterectomy. I feel like perimenopause has snuck up quickly. Should I change my diet back to pre-lectin?
Think on this. I mean, I think whenever I'm working with anyone, the first thing I want to ask is, why did we take it out in the first place? What were our observations with these foods? I think high lectin foods can potentially have some benefits. And if they're not causing us harm, they potentially, I'm thinking especially things like our legumes that do have some phytoestrogens that we know can be supportive of hormonal balance, right? Thinking some of our whole grains that have those complex fibers. But I'm always going to dig into how this food makes someone feel, right? What they're noticing, because I would say if there's a reason we took it out in the first place, that's what I want to dive into and understand. But those lectin foods may have some potential benefits for menopause as well. And I know the other thing I'll always mention is I know there are these, changes in body fat distribution and things that I know HRT can support and help with. And there's just some of those are just some natural changes as well. So sometimes just focusing too on, resistance training, continuing exercise, stress management, as mentioned before, I think is a huge one that we can't ever look past as well. But that's kind of how I would approach that.
Absolutely. Thank you for that. And it looks like we have a question, the same question from both Chris and Stephanie next. And they're both wondering, do you have any specific foods to help alleviate joint pain?
Alleviate what? I'm sorry.
To alleviate joint pain.
Joint pain.
Yeah, this is a great question. I would say this is where we're going to be focusing on a lot of our anti-inflammatory foods. So things we're going to be looking at are high antioxidant foods. So berries are a great source. Our fish with omega-3s, again, I love those. I know I pinch them a lot. Nuts and seeds are a great source. I would say the primary goal is getting more whole foods in our diet and less processed foods, though. That's what's going to help reduce inflammation in our body, which can support our joint health, along with that chronic disease prevention as well. You'd also be thinking about, I think, our bone health too, because that can support our joints as well. So making sure we're getting adequate calcium and vitamin D, getting whether that's through plant-based, leafy greens, legumes, that sense, or more of our dairy products, or even fortified sources like tofu are a great source of that as well. So those would be the primary ones I think of. I know there are some other nutrients that could play a role, like getting in some collagen. There's some research shows that can be helpful, whether that's through supplement or through food sources as well.
Absolutely. And it looks like our next question might be a little bit more Winona adjacent, but they're wondering, they say, I'm concerned about low libido. What and how does Winona assist with that?
So libido is almost always multifactorial. So there very well may be a dietary help with that as well. But certainly as you go through the menopause transition and your hormone levels drop, that can affect libido. So one of the things that we often offer is DHEA, which helps raise testosterone levels. And we do it at a very careful dose, 25 to 50 milligrams, enough to get you into a normal female range, not enough to turn you into a competitive bodybuilder. But that's, we're talking about libido. So it definitely can help with that. But estrogen can as well. Also, looking at vaginal health, one of the common changes in the menopause transition are changes in the vaginal health. So you can have pain, dryness, and if intercourse doesn't feel good, you're not going to want to do it, and that's going to affect your libido. So working on all those things can definitely be important. And then always, there's always the relationship issue as well. So as you're going through changes, you're going through a different stage of life, that can affect your relationship. And these things are obviously incredibly important to libido. So it always, you want to look at it from multi angles and multi facets. But certainly HRT can definitely be part of that can help with increasing libido.
Looks like we have a question from Sharon, and Sharon says, my HRT and DHEA ships tomorrow. After I start it, will my sugar cravings decrease?
I think in time, as you give your body a chance to acclimate to the medicine, it definitely should help. I've heard that from my patients, that it definitely has helped with cravings over time.
But don't expect it to help with the first application. So
right, it's not going to happen overnight.
Right.
Yeah.
This is a long game, and honestly, often for some women, things actually get worse over the first few weeks as your body adjusts to the new medication. So you kind of got to get through that adjustment period. It can last weeks or even a month or two, while things stabilize out. So don't be on it for a week and say this isn't working. You got to hang in there and really, this is a long-term thing that you're really looking for your long-term health. So that's the other thing I hear kind of in the question, this excitement, anticipation, which is great, but don't let it turn into disappointment when the first application of the cream or the first DHEA pill doesn't do much. So we do see that a lot.
Yeah, the one thing I'll add here, just about in sugar cravings in general, regardless of the time of life you're in, but these tend to be a bit of a vicious cycle. So if there's something that's kicked that off, and this could be hormonal changes that have kicked off, having some cravings, and then having large amounts of foods that have high glycemic index at a time, and then having crashes, and then having more cravings, and we can really find ourselves in a kind of dysregulated state when it comes to our sugar metabolism. And so these are situations where we take a step back, and sometimes it requires a bit of a reset in that cycle. And I think, as Dr. Green mentioned, the hormones can certainly be a helpful catalyst in that process. But it can be an uncomfortable reset as you're kind of removing yourself from that cycle of sugar and trying to reset the way that your body has kind of made that relationship.
And it looks like our next question is from Laura. And Laura says, I was diagnosed with lupus SLE when I was 18. It's been in remission since my mid-20s, and I've not had been on any hormones since. Can bioidentical hormones potentially cause a flare? Also, what is the risk of blood clots with HRT creams?
I've had a few patients with lupus that do fine on HRT and that have not experienced a flare with starting treatment. So I don't think I would be afraid of that. And ultimately, when we think about the risk of blood clots, we're thinking about DVTs, which is a deep venous thrombosis, or PE, which is a pulmonary embolus. Typically, your transdermal applications of hormones, like your patches, your creams, incur a lower risk of these clotting events than taking a pill. Because they don't have to be processed by your liver, and it's usually a lower dose that we require, that we use to be able to give you symptom relief, tend to be lower risk of blood clots than the other forms of hormone therapy. So
the other thing, the risk of blood clots with HRT, it's not zero, but it's really small. And I think it's a big fear people have that I think is usually, the fear is bigger than the real risk.
Mhm.
If you look at it, I mean, the risk is much higher with birth control pills than it is for HRT, for example.
Mhm.
I don't know, not too long ago, I said that to my wife and she was like, really? I was kind of surprised that she was surprised. But the risk of blood clots from HRT, the problem is the downside risk. I mean, if you get a blood clot, it's a big problem. So it's pretty dramatic. But the actual chance of that happening is actually very small. So certainly not zero, but it's pretty small.
Yeah, I think far more women have blood clots every year with birth control than we ever hear about from HRT. Yeah.
We have a question from Genesis, and Genesis says, does perimenopause affect your sugar levels? She says, I'm having highs and lows during the day, 45 to 180. A1C is 5.8. Diet isn't different. Doctor doesn't seem worried, but I feel horrible.
I mean, I would go back into my spiel about your heightened stress response and heightened cortisol. I mean, that can affect your metabolism and your body's ability to keep your blood sugar more regulated during the day. And if you're going through symptoms, and if you're dealing with insomnia, you're dealing with hot flashes, night sweats, all these things are throwing challenges at your body, which is putting your body under more stress and putting your body under more difficult circumstances to do the job that it needs to do, with your metabolism and your sugar metabolism especially. But I'd be interested to hear what our nutrition specialists have to say about it too.
Yeah, I was just going to add to that. Definitely, we know that when there's hormonal imbalance in menopause, but I also see this with PCOS, even just that our cells become less sensitive to insulin, which can lead to higher blood sugar. So that definitely can become a little more of a concern, along with that cortisol. And I think that's definitely a huge impact. So I always am glad you bring that up. And so I think that is something we have to pay attention to. Sometimes a little more focus on blood sugar interventions can be helpful, along with those other interventions that are supporting that hormonal balance. But that's where we'd really look into that consistent intake. I think it's great if you're already monitoring your blood sugar really closely and knowing what's going on, because that allows you to then go in and kind of make those tweaks. Maybe it's your meal timing, we're spacing out our carbohydrate amount, how much protein we're adding to meals, right? We can kind of play around with those numbers and see what helps you kind of keep your blood sugar stable. So that's great to always hear. I love to hear when someone's monitoring closely and paying attention to these things.
Absolutely.
And there is, sorry. Just one quick thing to add there is that, this is also, there's a bit of a limitation to the lab value of the hemoglobin A1C that's being demonstrated in this situation, which is that the A1C is an average value of glucoses over the last 3 months. So for folks that are having high highs and low lows, it's giving us the middle read there. So that's just something I always recommend speaking with your provider about. It's great that you have this data to kind of talk with them about it, but I really try to focus on that and kind of look for providers that are willing to see the whole picture here in thinking about glucose metabolism.
And it looks like we have time for one more question. And this one is from Stephanie. And she says, could you please give a few examples of complex carbs?
Yes, absolutely. Happy to.
You lit up on that one.
I always get to. I love when I get to just like talk about foods, and it's the yummy part of education, I always say. But yeah, so complex carbs. These are going to be our whole grains. So we're thinking oatmeal, quinoa, our brown rice compared to white rice, right? Our whole grain breads. Those are going to be our complex carbs, along with our starchy vegetables. So sweet potatoes, butternut squash that we're thinking of, our corn and peas. Those are all going to be our more complex carbs because they're a lot higher in fiber. Takes more work for our body to break them down. They keep us more full and give us less of these blood sugar spikes.
Awesome. That is a perfect answer. Thank you so much. And I just also want to say thank you so much to the Nourish team today for being on with us and answering all these questions. For those of you who are watching, I'm going to drop a link in the chat where if you want to make use of the amazing dietitians and team that Nourish has, you can definitely check them out at that link. But we have loved having you all. Thank you so much for your time. And thank you also Dr. Green and Dr. Kat for being here to answer some of the HRT questions and kind of what that looks like. And then just also a reminder to everyone who's watching, I know we didn't get to all the questions, and we love seeing this many questions because that means you're curious and kind of really leaning into your health and taking the ownership of it. We love that. But your doctor is available 24/7 in your patient portal. So please ask those questions to your doctor. They will love to assist you. That's what they're there for. But thank you again, everyone who's watching, for just attending the event. And thank you, Nourish team. Thank you, Winona team, for kind of being the people to answer these questions and give everyone some of your time as well. This has been a great event, and it's been great to have another one of these. But I hope everyone has a great night, and hopefully we'll see you all next time.
Great, thanks.
Thanks so much.
Good night, everyone.
Thanks, you guys. Good night.